Hello, I think we're ready to start. So before we begin this pandemic policing event tonight, I'd like to acknowledge the traditional owners of Australia and recognise their continuing connections to land, water and culture. We're currently meeting, those of us who are actually here, and it's a real thrill actually to have an evening event with real live people here. We're currently on the land of the Gadigal people of the Eora Nation, and I pay my respects to their elders past, present and emerging. Obviously, this is a hybrid event, so many people are also beaming in from various other parts of the world. And I'd like to pay my respects to the traditional owners of the country on which you are appearing from, and do feel free to put into the chat function where you are appearing from. So my name is Carolyn Mackay. I'm one of the co-directors of the Sydney Institute of Criminology. And it gives me great pleasure tonight, as I said, to welcome a live audience, as well as I wish to welcome the virtual audience as well. Thank you so much for joining us. And thank you very much to the Sydney Law School for assisting us in running this event tonight. So welcome to the Sydney Law School, welcome to the Sydney Institute of Criminology. My main function tonight is timekeeper, but I'm really excited to have this panel discussion and to be looking at the issue of policing a pandemic. So as we provided in the overview of this event, as you all know, that with the World Health Organization's declaration of a COVID-19 pandemic in March 2020, emergency health orders were introduced to contain that spreading contagion. So central to this aim was the restriction of social movement and the restriction of human gatherings. And this was very much enforced through new criminal offences and expanded police powers. So at the same time, assumed civil rights, our assumed freedom of movement, those sorts of rights really eroded with these state-sanctioned lockdowns of borders, places of work such as this university, close down of study in person, and socialisation was very limited. And then there were some certain measures aimed at particular targeted communities. Excuse me. So opposition developed initially to these measures in relation to the lockdowns. And it was really interesting to see how these sort of morphed into other movements. So we saw, first of all, the anti-mask and anti-vax movements, but then we actually saw the increasing influence of various conspiracy theories and groups such as QAnon, right-wing extremists and sovereign citizens. Anyway, to unpack some of these interesting changes that we've seen over the last couple of years, we've got this amazing panel of experts, diverse experts, who are going to examine the complexities of policing a pandemic in our democratic society. Now, perhaps befitting a pandemic event, unfortunately, one of our panelists has been struck down by COVID just today, which is I was expecting that at least one person would maybe, unfortunately, get hit by the virus. So unfortunately, Associate Professor Julian Drugan from the University of, from Macquarie University rather, can't join us tonight. Julian, if you're watching this online, we wish you a speedy recovery and we look forward to meeting you another time to particularly talk about online extremism. Anyway, it gives me great pleasure to introduce our chairperson tonight, who's one of my wonderful colleagues, Dr. Louise Boone-Quo. So Louise is a senior lecturer here at the Sydney Law School, and her research focuses on the interplay between criminal and immigration law systems. She looks at border policing and policing criminalisation more generally. In doing research, Louise seeks to understand how law and policing impact on racialised communities and what this tells us about what the law actually values. During the pandemic, Louise has collaborated with community organisations and other academics to bring to light how people have experienced COVID-19 policing and how it has operated. This research has highlighted the need for more broad-ranging conversations to rethink how we might govern society so that no one is left behind in a crisis. So I think that's a really nice way to segue to Louise, who will now introduce our panel of experts.
Good evening. So we've got panelists tonight, as Carolyn said, whose work has really afforded them insights into very different aspects of pandemic policing. So in this first part of the panel, I'm just going to introduce each of our panelists, and we'll also hear from them about what their work has illuminated about the policing of the pandemic. So we've asked panelists in particular to respond to, in this part of the panel, to share one key insight that their work has afforded into how pandemic policing has operated, and also to share a moment in the pandemic, in the policing of the pandemic, that has stayed with them. So we'll hear first from Dr. Tessa Boyd-Caine, the CEO and founding CEO of Health Justice Australia, which was established in 2016 as the National Centre of Excellence for Health Justice Partnership. Health Justice Australia partnership collaborations work to move community lawyers out of law settings, out of law offices, into hospitals and community health settings to collaborate with health services and their patients to address unmet health harming legal need. Tessa was previously the Deputy CEO of the Australian Council of Social Services and was the inaugural Fulbright Professional Scholar in Nonprofit Leadership. Her PhD was published as a book, Protecting the Public, Detention and Release of Mentally Disordered Offenders. And she is a graduate of the Australian Institute of Company Directors on the advisory committee of the Sydney Institute of Criminology, who's hosting this event tonight, and the board of Gondwana Choirs and plays ultimate frisbee. So Tessa, can you tell us a bit about what your role has, what sort of insights your role has afforded into the policing of the pandemic?
Thanks, Louise. Good evening, everyone. And it's a real pleasure to be back at the Institute where I worked a long time ago. But yes, my perspective this evening really is informed by the work that I do with Health Justice Australia, and to think about what that's looked like through the pandemic. Health, legal and social issues have really intersected in people's lives in lots of different ways through the pandemic. So we've seen it in the context of people living in public or in rental housing, where the presence of mold or overcrowding has really exacerbated spread of infection, both issues that in terms of people's legal rights ought to be well managed. You know, you ought not be living in public housing that has mold present. We ought to be able to provide enough housing for people not to be overcrowded. So a good example of where the kind of failure to meet legal obligations has impacted on people's health. We've seen it in the impact of fines and debt on people's mental health, on anxiety and stress. And we've absolutely seen it where people are not safe at home, either in relation to vulnerability to family violence or to elder abuse or to other kind of questions of safety. If services approach each of those problems in isolation, they often end up adding to complexity in people's lives. And so what we do at Health Justice Australia is try and build collaboration across the service system to work holistically around these kinds of intersecting needs. And supporting service collaboration would have been one strategy to respond to the pandemic. But in fact, it was security-led approaches that often made collaboration impossible. And I'm thinking about examples that we heard from the services that we work with in Melbourne, particularly during the lockdown of public housing towers in June 2020, where healthcare and legal assistance services were barred from accessing their clients, incredibly vulnerable, in really high need, at a time when access to those services could have made a huge difference. In the case of healthcare, accessing medications. In the case of legal assistance, understanding what were the boundaries around their ability to move and their ability to meet other needs. Enabling communities to lead would have been another strategy that we could have used to respond to the pandemic. Aboriginal and Torres Strait Islander community controlled services are one example. Collective impact is another, of community-led approaches that are perfectly primed to respond to a crisis like a pandemic, because they have a really deep understanding, not just of what communities need, but of how best to meet those needs. But instead, in the context of an unprecedented health crisis, governments returned to what I think of as really old school law and order approaches. And that played out particularly in terms of this compliance-led approach that relied really heavily on policing. As is so often the case in Australia, it was the leadership of Aboriginal and Torres Strait Islander communities that both called out these policy decisions and their implications, while at the same time advancing their own community-led solutions. And so one example that really stands out for me through the pandemic was the work and the advocacy of the Darua Elders Group, an association of Walgett Aboriginal people over the age of 60. And they said, and I'm quoting, "The New South Wales government made a big mistake for our community in tasking police to lead the local emergency response to this public health crisis." Walgett had the highest number of COVID-19 penalty notices adjusted for population between July 2020 and October 2021. This in a context where Walgett is one of the most socioeconomically disadvantaged communities in New South Wales. The elders warned that the financial impacts of these fines would be borne directly in child poverty, and the elders advanced a whole range of strategies, alternatives to those fines, that they felt would have made a huge difference in their community. In fact, Walgett's police inspector had given repeated assurances throughout community engagement over the pandemic that the police had the capability to use their discretion in how they applied the fines regime and other powers that had been afforded under the COVID-19 related public health orders. But the reliance on a policing-led compliance approach really led to increased fines on people with limited capacity to pay. It increased the interaction with the justice system among people who are already overrepresented within it. And it heightened community mistrust at a time when we needed to be strengthening trust and confidence in our service systems. And this brings me to the second way that I think we really suffered from an over-reliance on policing. And I'm thinking here not about the institution, but about the behaviour. I'm talking about the encouragement to scrutinise and report on each other. In New South Wales, where we are, this encouragement was explicit. We heard repeated calls from ministers to report on people who were not following the rules, on our friends, our family, our colleagues, and our neighbours. In a time of crisis, with heightened anxiety, particularly among people vulnerable to poverty and inequality, we needed to improve community trust and confidence. Instead, we resorted to policing ourselves. And I don't think that did us any favours in terms of people's ability to access support and services as they needed it, nor to build the community cohesion that we needed around a statewide or indeed a national response to a pandemic. So what I heard in the daily messaging in places like press conferences was a clear assumption that people had the choice to stay home and stay safe and well at home, and those who didn't would cop it. But for many people, that was not the reality, either because home was not healthy or it wasn't safe, or because people couldn't afford to stay away from work. I think the public health rules ignored a lot of the daily reality for many people, and they relied overly on policing as the main tool to compel the behaviours sought by those rules. We should have been advancing justice and health equity in our responses to COVID-19, but I worry that our policing approach really undermined both.
Thank you, Tessa. And I think we'll pick up on some of these themes after this in the second part of the panel, where we'll be having a more open discussion across the panel. Picking up on some of these issues as well. The next panelist I'd like to introduce is Jane Sanders, the Principal Solicitor of Shopfront Youth Legal Centre, a free legal service for homeless and disadvantaged young people based in inner city Sydney. The Shopfront provides court representation and other legal services to young people with high and complex needs who cannot effectively access legal aid and other mainstream services. Jane's an accredited specialist in criminal law and children's law with over 25 years experience appearing for children and young adults in criminal matters in the Children's Local District and Supreme Courts. Jane's work in improving access to justice has been recognised by the award of the New South Wales Law and Justice Foundation's Justice Medal and the Terry Keeney Memorial Award, recognised her dedication to the profession, excellence as a criminal lawyer, commitment to clients and concerns for social justice. So Jane, in your role at Shopfront, what did you learn about how pandemic policing operated?
Well, I think I could just point to Tessa and say what was said. Oh, sorry. because our experiences, of course, pick up on a lot of the themes that Tessa has spoken about. Being a little bit more specific about children and young people, I think what we saw with the policing of the pandemic is partly more of the same, in that disadvantaged young people, including the ones we work with, are routinely stopped and searched by the police, inquiries made as to their identity and the like, in the hope of building up intelligence on them, or doing checks on the system to see if there's intel that might provide the foundation for a search. So we see that all the time with our clients, pandemic or no pandemic. I think that having the COVID-related restrictions, stay-at-home areas at certain times, 5K radius for certain activities, certainly gave the police more opportunities to speak to people and question them about what are you doing in the area, where do you live, etc. So yes, just more opportunities for those kinds of interactions. What I think, though, the police didn't seem to understand about these COVID-related restrictions and the various offences is that it did not give the police any additional power to stop people. There was power to demand ID in certain circumstances. If you were out exercising, you had to carry ID on you, I think, and show it on request. But I think that there were, as there are outside of the pandemic, unfortunately, with vulnerable people, police who are basically pushing the boundaries and acting beyond power, either through ignorance or just through feeling pretty confident that they're going to get away with it. So we did have some very questionable or just downright unlawful stops where police then conducted searches, found certain things that might be a knife or a bit of weed or whatever. And we have had, well, because of the delays and the backlogs in the courts, we've actually had very few matters actually going to hearing to test these issues. But we certainly have had some charges withdrawn, I think, once the police realised that they actually had no power to do what they were doing. But unfortunately, most of the time, the police do get away with stopping people, questioning them, searching them, and I think the pandemic provided more occasions to do that. But also there were, and this is a point that I've been speaking a lot with, well, I guess a group of people from various different agencies working with young people about COVID and fines. But the lead agency definitely is Redfern Legal Centre, and in particular, Sam Lee, who is their police powers solicitor. One of the things that she's experienced particularly is young people who have never really had any contact with the police and who've been sort of drawn into this web of police contact through being fined for basically just for doing things that young people do, like going and hanging out on the beach or whatever, or finding things a little bit difficult at home and being out at night or whatever, and they have been drawn into this. One of the really troubling things, of course, is the issue of fines to people in general, vulnerable people in general, but particularly to young people. Tessa did mention that the top area per head of population for issuing COVID fines is Walgett. The next ones on the list are, guess what, Brewarrina, Wilcannia, Coonamble, Burke, and the list goes on. So about the top 8 are all those regional areas with, guess what, high Aboriginal populations. When you get to the Sydney metro area, the highest topmost fined postcode during 2021 was Mount Druitt. Again, similar demographic there. In relation to children, so children aged, 17 and under, so under 18. In 2021, nearly 3,000 COVID fines were issued to children, totaling a value of $2.1 million. Of course, only a fraction of that has been or will ever be paid. Most of those fines were $1,000. So the on-the-spot fine amounts, as people will probably know, differed according to whether it's not wearing a mask or breaching stay-at-home orders or whatever. So the vast majority were $1,000 fines, which is still a very significant amount for a child. Bearing in mind that if the matter went to the children's court, if the young person chose to court elect and go to the children's court, the maximum fine the children's court can impose on anyone for any offence is 10 penalty units, which is $1,100. So that $1,000 on the spot fine is almost towards the jurisdictional limit of the children's court. Then there were a number of kids, just under 40 kids, issued with $3,000 on the spot fine, and then another 17 children issued with $5,000 fines. So the fact that the on-the-spot fine for a child is greater than the amount the children's court could impose if the young person court elected is fairly extraordinary. There have been a number of requests, not just from children and young people, but from adults as well, people writing to Revenue New South Wales requesting a review of the fine. Generally, the review applications have not been overwhelmingly successful. I think there have been some withdrawn as a result of that. Certainly our experience seeking review of penalty notices has been less than successful. We have had maybe one or two withdrawn and a caution issued in their place, but certainly it seems that Revenue New South Wales, it's hard to know who's actually looking at the review applications, whether it is Revenue or whether it is actually the New South Wales Police who are the issuing agency. But either way, they seem to be taking a fairly for want of a better term, cookie cutter approach. They're certainly don't seem to be really assessing the individual circumstances and doing a proper review of those. I think I've probably spoken for long enough, at least to begin with. So thanks for listening. There are a few issues, I think, to spark discussion. Thank you.
Thank you, Jane. If you could pass that on to, thank you. So our next panelist, Mick Willing, offers his perspective from 31 years with the New South Wales Police Force. In his former role as Deputy Commissioner of New South Wales Police, Mick Willing led a team of over 5,800 members providing policing services across the northern, western and southern areas of New South Wales. In this role, Mick was also the New South Wales Deputy State Emergency Operations Controller. Prior to becoming Deputy, Mick was Assistant Commissioner, Commander Central of the Central Metropolitan Region, providing community-focused policing services and held responsibility for leading and delivering complex security operations for major events. As Detective Superintendent, Mick was the longest serving boss of the New South Wales Police Force's Homicide Squad, and Mick has received numerous awards for his work with New South Wales Police, including the New South Wales Police Medal, the Commissioner's Commendation, the National Medal, and most recently, the Australian Police Medal in the Queen's Birthday Honours. Mick, is there an event or a moment in the policing of the pandemic that you've found particularly instructive?
Well, thank you for the opportunity of being here, and clearly there are a lot of issues that are really, I guess, at the centre of this discussion, which are really important. And I felt it was appropriate that I provide a response from a policing perspective. And I'm no longer with the New South Wales Police Force, as many in the room know at the moment, but the roles that I've had have sort of, I guess, thrust me at the centre of COVID policing over the last few years. So just taking a step back, and I'll come to that, answer that question if I can. Taking a step back, I was running the state's bushfire recovery process and I was offline from the New South Wales Police when COVID hit, and I came back into the New South Wales Police Force really as it was starting to take hold of the state, and really policing pivoted to focus, primarily or just about, holistically upon the COVID situation as it was. In my role as the Central Metropolitan Region Commander, which has been mentioned, I had to lead the operations that police the protests. And starting with, the big Black Lives Matter protest on the 6th of June, 2020. I was the police commander for that, and I was the police commander for follow-up protests after that. And I've got to say, it's probably one of the most difficult, if not the most difficult situation that I've found myself in policing. I remember driving into the Sydney Police Centre at the time and knowing what I guess, would unfold, and I was physically sick in terms of what I thought would unfold. We had, for the first time ever, gone to the New South Wales Supreme Court in relation to orders to deem the protests unlawful or unauthorised, I should say, and that were groundbreaking moments for us. So I was responsible for that. Later, as a Deputy Police Commissioner, I had responsibility for regional New South Wales policing. So the issues that have been raised, I sat directly over the top of those as a Deputy Police Commissioner. And it was a difficult situation. And I say it's difficult. It was difficult for individual police officers to enforce health orders for the first time when you were balancing justice and liberty versus the advice from health around the dangers of the pandemic. It was challenging. I've got to say that. The impact on minority communities, absolutely, I understand and accept that occurred. It was a very difficult. Some of those communities in regional New South Wales were policed on the back of plans that had been developed with local community members in some locations, not all. And I must say, underpinning what was occurring inside the police force was a strong drive around community safety. And that was what we were trying to do, was ensure community safety because of what we were being told about the virus at the time, and particularly with the Delta strain of the virus that struck in 2021. I, as the Deputy State Emergency Operations Controller, was a person who sat in crisis cabinet, as it was then called, and listened to the discussions from different parts of government around what to do in relation to it. And I've got to say, it was extremely difficult to deal with. Unfortunately, or fortunately, one way or the other, the New South Wales Police Commissioner was designated as the lead for the response to the pandemic. Normally, that would be a role taken by Health, New South Wales Health, but it was a decision that was taken in 2020 for the New South Wales Police Commissioner to lead that response. That was a decision taken by government. I've got to say, on the ground, policing some of those protests, individual officers who all have their own views and opinions. The way that they police those protests, I guess, will be subject to debate for many years to come. But we were looking what was happening around the world and some of the responses that were, I guess, undertaken by policing in the United States in particular. And I remember, doing a press conference myself and said, we are not the United States. We do not police the same way as the United States. I'm a big believer in the legitimacy of policing and that we police by the consent of the community. And I guess to come back to the question at hand, it wasn't a single moment except for that first large Black Lives Matter protest for me, but it was the growing concern that I had around legitimacy and the strain that what was occurring and the way that we were having to police the health orders was impacting on that legitimacy. And most certainly I had discussions with the then New South Wales Police Commissioner, who was of the same view, that as soon as we could get back to normal community policing and start re-establishing those relationships post-2021, the sooner the better.
Thank you. Our fourth panellist is Dr. Greg Martin, Associate Professor of the University of Sydney School of Social and Political Sciences, and who is currently the Associate Dean of Student Affairs and the Interim Deputy Head of School in Social and Political Sciences. Greg has a doctorate in sociology and degrees in sociology and in law, and has worked as a lecturer and research fellow at universities including Keele University, University of Leeds, and University of Western Sydney. He's the Associate Editor of Crime, Media and Culture, the journal, and has been a member of the editorial advisory board of Social Movement Studies since its inception in 2002. Greg's area of research includes criminal and constitutional law, cultural criminology, political sociology, protest and public order policing, and his current research focuses on pandemic policing, and Greg has particular expertise in this area in the policing of protests in the pandemic. So very much kind of linking to what Mick was discussing before. So yeah, Greg, if I could ask you, what do you think is most kind of important, or the most important or provocative finding from your research?
Okay, thanks, Louise, and thanks for having me, everybody. I don't have on the ground experience as Mick does, but that does go to one of the key areas of interest that I have is around the jurisprudence of pandemic policing around protest, and the jurisprudence around that has emerged, and this distinction that critical legal scholars have between law on the books and law in action. Again, looking at what a lot of the other panelists have talked about, some of the issues that I've looked at in relation to protest policing in particular, which is one of my key focuses, has been issues to do with divergent use of police discretion at protests, issues around self-regulation, issues to do with over-reliance on policing when other measures potentially could be used, and a continuation of similar patterning that we've seen previously around the criminalisation of dissent. So one of the things I've been interested in is how history has almost at times repeated itself. So I've been interested in looking at protests that have occurred historically around the Spanish flu pandemic, not so much collective protests, but individual acts of defiance around anti-mask wearing and resistance to wearing masks, for example, and some sparking of protests around that as well. So looking sort of historically 100 odd years ago, and it's interesting when you interrogate the historical literature, how many of the similar sort of issues have occurred around the Spanish flu. Those sorts of resistance, that sort of resistance to government regulations restricting rights and so forth, and you know, the sort of use of fines as well, is something that occurred during the Spanish flu. So I'm interested in the historical aspects of it, and also the more recent historical aspects around 9/11. So one of the things that I've been interested in is how there are comparisons between what's happened recently and 9/11. So the intervention of courts, for example, to curb, restrict, or have a dialogue with police about the police use of powers. So one of the things that I've been interested in is the New South Wales Supreme Court's jurisprudence around protest policing, where at times protest has been allowed and at other times it's been prohibited. And that's often been, the court has restricted the right to protest on the basis that community transmission is high, and therefore protests could become super spreader events. So there's a series of quite unique, actually, jurisprudence in New South Wales around protest policing. And feeding into that, some of the key themes that I've looked at, which relate to the literature that I do research around, include issues to do with negotiated management. The idea that is entrenched in the Summary Offences Act here, that protesters and police enter into a negotiation, a bargain about protest purpose, protest numbers, and protest route, and so forth, and how that, I'm interested in how that plays out in practice. So again, this sort of this distinction between law on the books, you know, courts may well declare a protest lawful, but it might not necessarily occur in practice. Probably the most emblematic example of that was in the UK, when there was the Sarah Everard protest at Clapham Common. The High Court basically advised the police to enter into negotiations with Reclaim These Streets around the protest. The police refused to do so, and we saw the images of heavy-handed policing at that event occur. At the same time, there was a protest in Birmingham. Again, the police advised the protesters not to hold the event, but that event actually occurred without any incident. So there we have an example of divergent use of police discretion. So that's sort of interesting for me, because it raises the issue of law in action, how police actually exercise their powers on the ground of protests. So one of the key sort of concepts I've got to emerge from my research is this idea of the relative autonomy of protest policing. I'm also interested in critiquing the negotiated management model, which doesn't always occur in practice, as I've indicated. So that's really the key kind of ideas, some of the key ideas that I've managed to accumulate in my various travels over the last 18 months.
Thank you, Greg. Yeah, so I think now that everyone's had a chance to introduce themselves and a little bit about their work and how that's provided them some insight into the policing of the pandemic, we're going to move into the second part of our panel discussion, which is a bit more free-ranging. We'll be posing particular questions that will be, one of our panelists will kick off answering, and then it might go to a bit more organically for others to contribute their thoughts. We've structured this part, we've structured some time at the end of this discussion for questions from the audience here and also online. So if you could note down your questions as they arise and come to you, or add them into the chat if you're online, that would be great. And then after the panel discussion, we'll turn to take those questions and further our discussion. I'm going to just kick off with a question to Tessa, again, Tessa Boyd-Kane, if we could start with you. Because in your role at Health Justice Australia, you asked, what if instead of seeing police at the daily press conferences, we saw social services? What do you see as the main problem of a pandemic policy approach that centred police rather than social services?
Thanks, Louise. I think I want to start by being clear. I'm not suggesting there was no role for police, but I do think the way police were centred, and I think there were political and policy choices about that, very much to the point about who made those decisions. I think the way police were centred had a really detrimental effect on health and equity. And one of the ways we saw that play out was that people stopped accessing services. So we heard every day from the health, legal and other services that we work with about rising levels of anxiety and distress and the impact of those rising levels on people's mental health. We heard directly from healthcare services about the needs of clients in drug and alcohol treatment, people particularly on methadone programs where daily access to care is absolutely vital to the effectiveness of that treatment. We heard about financial vulnerability. We heard about safety at home and in other contexts, particularly arising out of the impacts of the pandemic. And so people were becoming isolated, people had rising levels of need for support, but people were making decisions for themselves not to access care that they needed. And I think some of the signalling around the most important thing you can do is stay at home, and our expectation that you do that will be policed, I think that signalling was really central to those choices that people were making. So, we heard the World Health Organization pick this up, particularly in the context of healthcare. We know people stopped accessing cancer screening. We know people stopped having prescriptions filled. We've heard about that in the context of healthcare, but we were hearing about that in our own work in relation to a whole range of other services, particularly legal assistance. And these are the kinds of problems that were intersecting in people's lives are the kinds of problems that services, particularly services working together, are really well placed to respond to. So these are service solutions that prevent crisis in people's lives. This is about the timeliness and the way in which people can access the care and the support they need to prevent crisis. And if you're thinking about the kind of alarming rise in terms of vulnerability to family violence, that's one kind of crisis. The impacts around credit and debt and financial vulnerability, particularly for people in insecure work, another kind of financial crisis. I mean, these are serious crises that we're talking about. It's not just did you get to talk to someone today? It's actually the kinds of service responses that can make a really significant difference in terms of people's health and well-being. And I think in the context of this kind of public messaging where we centred police without any other, for a very long time, without any other kind of signalling, I think that centering of police really played into this kind of discouragement for people to access services. So for months, there was certainly in New South Wales, for months, there was very little public messaging encouraging people to seek help. There was very little communication about all of the work that services were doing to create online portals, to move their staffing beyond 9 to 5, to create new and different pathways for people to access help in the ways that they might need it. None of that was picked up in any of the public messaging that I was seeing, particularly led by our political leaders. And I was really pleased to see after that opinion piece that, in fact, the very next day, the police were not standing next to the Premier as the Premier issued their key messages about vaccination, about the kinds of health concerns that we had. And over time, we started to see other kinds of services reflected. So again, just to reiterate, the point is not there was no role for police, but the centering of police, the assumption that what we needed was compliance-led approach to public health, and that the police were the only tool, if I can say, the only service response we needed to do that. I think that really undermined health equity.
Yeah, I can probably just add to that too. Having stood at those press conferences a number of times, it was generally Deputy Commissioner Gary Warboys and then myself at those press conferences. The day that they said you're no longer coming was a pretty good day for us in lots of ways. But it was a conscious decision taken because I think in terms of the timing of it, I guess that's, again, something to be debated. But there was an acknowledgement that they needed to put people up, like the chief psychiatrist and others, to actually start getting other messages out. And it was literally a day, I think it was a Wednesday, to be honest. It was getting ready to go over for the 11 a.m. press conference, and being told you're no longer required was pretty good. And I understand and acknowledge that, the flow-on effect of having police there in uniform delivering that message, had flow-on consequences. The reality is that myself and Gary Warboys were there in our emergency operations controller roles, and that was lost, understandably, when you're standing in a uniform and all people see is police. But the role that we were taking was around the emergency response, but inevitably you're answering questions in terms of enforcement. But yeah, I think you're right.
Could I chip in briefly? Sorry. But that also reinforces what some of the protests were about as well, more generally, about defunding police and the over-reliance generally on policing and law enforcement when other agencies and other services can be used. I read a piece a while ago about that stated that the majority of police work is actually not related to crime. So it goes to that broader perspective, I guess, or critique, that we need a better model of policing generally, not just in relation to the response to a health crisis or in relation to protest policing.
I would just add my agreement to that, and it is more general. We clearly need a better model of providing social support to the most vulnerable, rather than relying on policing and incarceration to solve social problems or to just sweep them under the carpet.
Well, it kind of leads, I think, I guess that's part of that, isn't it? To have these kinds of discussions, even though, there's a feeling now that the pandemic policing has finished and that conversation is finished. As we've heard many times through the pandemic, there's the idea that we ought not to waste a good crisis, to have some much bigger picture thinking about what role or how should our society be governed. So rather thinking big picture sense as to which agencies or which parts of our the social mechanisms ought to be supported to protect life and to ensure the well-being of everybody. Jane, just in thinking about what you were talking about in your introduction, you mentioned that you didn't think there was, in some ways, pandemic policing was simply an amplification of the day-to-day criminalisation that young people experience in public spaces and in other spaces. I'm wondering if you could speak a bit more about that, as to, you know, whether you think pandemic policing was materially different from pre-COVID policing for young people.
Well, I think it depends on which group of young people you are talking about. Certainly there have been young people or people of other age groups for that matter who regard themselves as ordinary law-abiding, dare I say, middle-class people who don't really come into contact with police, and then they find that their little swim down at Bondi Beach, or their stroll around the neighbourhood, or their shopping, or whatever, or just sort of being a slightly naughty teenager and roaming around rather than being at home, they have suddenly found that they're attracting the attention of the police, whereas normally they would be part of a demographic that would be largely ignored. But mostly the anecdotal experience, of course, that I have working with the most vulnerable young people, I think, as I said in my introductory remarks, to me, it seems like it's been more of the same. And it has, I suppose, amplified the level of policing that is the level of attention that policing attention that these young people get. It's created more opportunities to engage with young people out in public places, to and perhaps more reasons to, frankly, to criminalise them. So I don't know. I don't know really what else I can say about that, but I don't have really a demographic breakdown. Well, we have seen the demographic breakdown of the postcodes in which the greater number of fines were issued per head of population, and that's very heavily skewed towards Aboriginal communities, which of course just reflects the fact, I think, that people in Aboriginal communities are less likely to be able to stay at home for whatever reason, are perhaps less likely to be receiving and taking on board or understanding the messaging around what the COVID public health orders actually say and actually mean for them, and are much more likely to be policed, to be the subject of police attention. So, yes, as I see it, it was probably an amplification. We also work with quite a lot of young people around the Bankstown, sort of southwest Sydney area, often young people from Middle Eastern backgrounds, from communities which traditionally have a pretty fraught relationship with the police at the best of times. Very legitimate policing efforts, and I have to say, I don't think, I mean, as Mick has said, I don't think that the police particularly wanted this role. I think there are a lot of police officers who did find it extremely difficult, who I think wanted to take a more conciliatory approach and just try to encourage people to go back home or whatever. It does become difficult when you have got fraught relationships, and any kind of interaction escalates pretty quickly. So we've worked with kids, of course, who are sort of out on a basketball court or whatever, probably in breach of the orders, police trying to come and move them on, and then it's all on for young and old. So I think an amplification of issues that already existed.
Can I chip in again? Sorry. There's actually police data that indicates that fines have an inverse relationship to COVID infection rates in suburbs across Victoria and New South Wales. So it's just to add a little bit extra to that information.
I can respond to everything at some point. Look, I think you're probably right in terms of an amplification of it.
Sorry, I think it is on.
It's on. I think my experience is that police officers, by and large, found it very challenging to enforce health orders, and the amplification of that is probably just natural consequences of that heightened enforcement regime that was put over the top of policing health orders. Can I just add a point in relation to the protests as well? I've got to say, you know, when you have a law that says no more than 30 people can congregate together in a protest, and you have, you know, intelligence saying that thousands of people are going to turn up, it's very difficult to deal with that, I've got to say. It was extremely challenging. The Supreme Court matters, I think I took 3 or 4, maybe more. My colleagues took a couple as well to the Supreme Court. The balance between community safety from a health perspective and the right to free speech was absolutely in the middle of that. Police, believe me, police do not have the view that we are preventing free speech. We are for free speech, without a doubt. It was all about community safety from my perspective as a police commander over the top. And when you've got a law that says that, you know, that restricts movements, it's very difficult to enforce that when you've got, I guess, you know, a situation where the powers that be politically are requiring one thing, and the consequences of that, you know, sometimes like those health consequences are unforeseen.
Maybe just another comment as well. I thought this was, oh, it's on. Okay. Another comment just about, it was also extremely challenging, well, for police, but also for citizens trying to comply with these public health orders, because they changed all the time. Even for a lawyer whose job it is to interpret and understand the law, we had real difficulty with it as well. So that was another complicating factor. But I think more generally, so I think really police are very much excused for perhaps getting it wrong sometimes, and perhaps issuing fines where they maybe shouldn't have, or where maybe the person was in breach of the public health order, but it's just changed 50 times in the last month, and maybe a little bit more discretion could have been used and maybe cut the person a bit of slack. But I think more generally, and I'm not going to let the police off the hook so easily, more easily, my experience has been over the years that the level of training that police receive, or the level of training that, the amount of training that actually sinks in, is not great. In some regards, I would say it's pretty woeful. I remember when the Law Enforcement Powers and Responsibilities Act, aka LEPRA, commenced, and that was in 2005, I think. And so that was a new act which basically sort of pulled a whole lot of police powers all together into one act. It changed a few things, and the training that was delivered around that was actually really good. And for a few months at least, every police officer pretty much in New South Wales seemed to understand the basics of what their powers were and what they had to do if they're arresting somebody, the sort of information that they have to provide or whatever. I mean, some of them would still get it wrong or still overstep the mark, but the training was pretty good. But then with attrition, with people moving on, leaving the force, going, you know, moving into different roles and whatever, certainly the level of training I feel now is really pretty woeful, and you see it playing out in interactions with people on the streets, in what I believe are, and what courts often find are, unlawful exercises of police power. So, and I think the pandemic highlighted perhaps.
Can I just add, sorry. So those health orders were changing literally daily, and unfortunately, what was happening on occasion was the orders weren't being signed till almost midnight, and they were coming into effect literally minutes afterwards. And getting, that was through process, and but getting that education to police was absolutely critical, because literally you could have a health order at 11 o'clock at night, and then at 1 o'clock in the morning have a different health order, and police on the street on the same shift having to change. It was an extremely difficult challenge. Our General Counsel did a fantastic job in terms of pulling together fact sheets, and sometimes it was quite complex, but fact sheets and getting them out to police on the ground. But inevitably, there are officers who are going to get it wrong.
Yeah. Okay. And yeah, I mean, I guess that goes back to that kind of, that we're sort of teasing out a few different dimensions of policing in the pandemic. One is goes to that issue of perhaps, where individual police officers and their actions. Another level is the organisational decisions. And the bigger question is the social function which police have been charged to perform. And each of those have bring up really different issues. So when you're talking about the issue of the balancing act that police were asked to perform in relation to the policing of protest, one thing that came to mind for me was that the law itself differentiated between the number of people permitted in a protest gathering as opposed to a gathering for a sports event. So looking at those kinds of contrasts bring up, different dilemmas, like what then, and kind of highlights the kind of policy issues that go towards the thinking about police and policing, not just as an institution, but as an institution performing a social function that's been charged. And that's something I think that we all have a stake in discussing and debating. Just as we were talking about protest policing, I wondered if if there was something there that sparked a comment you'd like to make.
I mean, it's about signalling, isn't it? Political signalling. I mean, when you've got a sporting event that's allowed, but a protest of 20 to 30 people that's not allowed, there's a political signal being given up there. And that's why people are sort of critical of these types of powers that are being given to police on that basis. And that's where all of the sort of arguments start to come into play about the increased, the continued, because it's more the same, criminalisation of dissent, criminalisation of protest. And I disagree that it was all about policing by consent and so forth, because there were incidents and occasions where there was clear probably operational, but also maybe, I don't know because I'm not privy to the information, but maybe political decision making. The use of water cannon in Melbourne, on the streets of Melbourne, for example. Here at the University of Sydney, there was heavy-handed policing of protest as well. And I mentioned in my introduction the different operation of police discretion in the UK context. The Metropolitan Police clearly, although they were exonerated, clearly using repressive tactics at the Sarah Everard vigil. So yeah, I mean, notwithstanding the complexities, there was those sorts of policing modes or styles were in evidence during the pandemic.
Do you want me to weave something into?
Oh, okay, go for it.
Look, you're right. I think the Victorian approach to policing the pandemic was very different to what we did in the beginning. I certainly they had a squad of people put together to enforce the COVID restrictions in Victoria. The way that they police protests is different from what we do here, certainly tactically different from what we do here. When we really enforced the orders was Operation Stay at Home, which was, perhaps you might get to it around June 2021 through to the end of August 2021, which was a conscious decision that was taken to do that. But prior to that, the number of infringements that had been issued, I think if I pull a figure out of the air, we were like a 10th of what Victoria were issuing at the time. But that changed certainly with the Delta variant.
I mean, the issue of policing style is also an international comparative one as well. People have done research comparing France and the Netherlands, for example. The style of policing in France was more repressive as compared to the Netherlands, which was more community focused. There was a sort of an interweaving of surveillance as well. But the fines that have that came out of those two modes of policing were very different. I mean, they're different populations, obviously, but there was 1.1 million fines issued in France, I think, over a 2-month period in 2020, compared to 36,000, I think it was, in the Netherlands. So there are definitely globally many policing styles, protest and everyday policing as well. And one of the things that the pandemic sort of has highlighted for me, because I've done a lot of kind of cross-jurisdictional reading around this, is that there was no one sort of way in which it played out. And there were complexities operationally as well. I mean, in the UK, the government was asking, and the police were asking, shopkeepers to work in partnership with them to enforce mask mandates. And in California, on the other hand, police were refusing to do it, just flat refusing to, because it was just impractical. So very variegated responses.
As we kind of started to touch on the enforcement practices in 2021, I wonder if we could take our conversation to, yes, the 2021 policing of the pandemic. And one of the really interesting findings that came out from the Bureau of Crime Statistics and Research, BOCSAR, the New South Wales Bureau, found that New South Wales police issue of fines for COVID rule breaches during that period was very much a product of police enforcement practices rather than reflecting an underlying pattern of non-compliance by individuals. So BOCSAR, the Bureau of Crime Statistics and Research, found that people in LGAs of concern faced a much greater proportion of fines and other issues in relation to police, despite also looking at evidence that suggested that people in LGAs of concern were the most compliant with COVID rules. And just to kind of spell out the significance of that, when we're thinking about areas that have been touched on tonight, Mount Druitt and Liverpool, each people in those those postcodes faced fines collectively of over $1 million in each of those areas, and are well known to be areas that face great social and economic disadvantage. So yeah, just on this issue of that when we look at the prevalence of fines, that they it speaks to the fact that these findings speak to the fact that they reflect not the extent of non-compliance, but the extent of police enforcement. Yeah, I wondered if you could respond to that, Mick.
The microphone. Look, it's right. You're right. I think the level of non-compliance, having a look at that BOCSAR study, was around in answer to surveys. So in terms of the levels of non-compliance in those areas versus others, I'm not too sure, but I'll accept that that's what they found. But yes, the enforcement around those 12 LGAs of concern was heavy, and it was put in place because of the rates of the Delta variant that were within the community at the time. And that was the Operation Stay at Home that I mentioned, which I'm sure you're all aware involved a heavy policing of those LGAs. What we don't know is the impact of that on the virus itself, and how it diminished, or how it had any impact, or whether it curbed it or not. But there was certainly a lot of analysis going on inside of health and other agencies around the impact of the policing on the virus itself, particularly in places like Cabramatta and Fairfield and Bankstown and others that you mentioned, and whether or not that actually curbed the virus or stop it spreading. One of the biggest challenges that I had coming into the deputy regional role was trying to stop the virus spreading into regional communities. It was inevitable that it was going to happen, I think, but we did everything we could under a lot of pressure to try and enforce heavily the surrounds of Sydney to ensure that the virus didn't spread out. Unfortunately, it did as well. And there were areas like Newcastle and others that very, very quickly saw large numbers of cases of COVID, the Delta variant.
Can I just pick up two things that really strike me in relation to that whole experience for all of us? One is, thinking about what it meant to rely on police as the primary response to a public health crisis. So the health evidence is really clear that the more people are in control of the decisions they make about their health, the better their health outcomes. You would think that would be a really useful piece of information to drive policy and responses to a pandemic. And so I think, just again, to reflect who was making decisions about the reliance of police, ministers who were standing in front of us every day saying we are following the health advice. So you've got this kind of health advice-led response on the one hand, and then a reliance on police to enforce it. Like, there's just such an inconsistency there in the policy. And I think if we're thinking about lessons from the pandemic, again, the lesson for me is not there's no role for police. The lesson for me is accountability of our leaders about the kinds of policies they implement to keep us all safe. I think the other thing that really struck me in the context of that shift in policing and that shift in attention around how we were responding to the pandemic was about its implication in place. So we went from a situation where, yes, there were public health orders, yes, there was a police presence, yes, people were more likely to be policed if they were out in ways that they weren't supposed to be, but that was a broad experience, to very specific postcodes that were being policed very visibly in communities that already were overrepresented, at least in terms of interaction with justice agencies, policing, prisons, courts. So just to pick up again this issue about trust and confidence, and that is, I think we talk about that often in the context of political trust and confidence, but we rely on community trust and confidence in relation to our services and our systems at every step of the way. You would think we would need that even more in a context of crisis like a pandemic. And so again, just to pick up what's happening in the broader context, communities that already feel over-policed, that already feel represented in terms of interaction with justice systems, now having this very visible presence of policing on the streets, in their lives, just the impact of that and the decisions around that, I think, will continue to have repercussions for us in terms of how communities are able to trust and engage with service systems, policing and beyond.
I was just going to say, Tessa, the first comment about listening to the health advice and letting that drive policy on a broader level, you would think that might also inform some drug policy and some sensible drug law reform, wouldn't you? That's if we want to broaden out the issues. On the positive side, the plus side of the pandemic were no music festivals, so kids not sort of funneled into tents en masse and strip searched. So there's one upside.
Actually, Tessa, I want to pick up on, so we're talking about this issue, we've been sort of lingering on this issue of, what promotes compliance and commitment to adhere to public health objectives. And I wondered if people on the panel had examples of initiatives that have worked or approaches that have worked in Australia or in other jurisdictions to promote compliance without reliance on police.
Well, I've got two. One answers your question and one kind of flips it. So a service that we work with closely was talking to us about the influx of requests for legal advice that they had received from people who opposed vaccination mandates and who were seeing that the requirement on them to get vaccinated, for instance, to maintain their access to employment, was an infringement of their human rights. Now, on the legal merits, the legal service could make a call very quickly that there wasn't a case to answer. But in the context of a pandemic where they understood how important it was that people actually worked through the issues around vaccination, this legal service decided to start actually spending time with these potential clients to work through with them what were the issues around individual rights, what were the broader public concerns, and really saw that as their contribution to a public health response to the pandemic. So again, if you think about not a policing response, but a justice response, the opportunity for justice organisations to engage in a whole of service system response, I think there's something really powerful there. The other flip, I guess, again, is to challenge this idea about compliance. So on the flip side, we heard from drug and alcohol services who overnight realised that their clients in methadone programs could no longer continue in those programs. So I'm thinking particularly about people at the early stages of methadone programs where their access to treatment relies on daily visits. You know, we control very tightly how much methadone we provide people. So you have to be in contact with services daily in person. Overnight through lockdowns, that became impossible. Services had to push governments to redefine regulatory boundaries to enable services to keep their clients engaged in treatment. And these are critical issues at any time in someone's life. They were no less critical because there was a pandemic running. So again, the trust and the relationships between clients, services, and government was actually about challenging regulation at a time when that regulation was no longer fit for purpose. So I think a very different way of thinking about what does compliance look like and how do you build those trusted relationships that enable you to work collaboratively around unforeseen problems.
Thank you. I'm just going to do a time check.
I hope it's not 8:45. 7:45. That's my bedtime.
Well, I guess I'd just like to ask some, I mean, one of the issues that we did want to kind of hopefully touch on tonight was issues around the way in which the pandemic has seen a growth in conspiratorial thinking and the sorts of challenges that poses to many different facets. Poses challenges in law, health, and in policing. So perhaps if anyone would like to say a few words on that point, and maybe we can pick up on it in more detail in the Q&A part of our discussion. I'm just very open.
Oh, sorry, you go. I don't know if I can say anything.
I can say that what we saw in protests as they moved on and evolved over time were different, a blending of issues that were certainly quite evident, and a blending of different groups that were involved in the protests over a period of time. Now, in terms of the way that they're policed, it is no different. Like it's about community safety. It doesn't matter what the issue is. Because we often get a variety of issues that are I guess vocalized in a policing in a protest situation, but we certainly saw that.
Yeah, so from a legal point of view, actually, it's and a sort of sociological point of view, generally speaking, those types of protests didn't have the sort of COVID safeguards put in place, or protest organisers didn't, if there were organisers, didn't have the COVID safe protocols put in place, such as, you know, face masks on and so forth. So it does actually pose a different sort of issue operationally, I guess, in terms of a public health issue, but legally it also plays out in the jurisprudence as well. The New South Wales Supreme Court, when it was making determinations about protests and whether they should be allowed or not, factored those sorts of things into their decision making. You know, were there going to be COVID marshals in place? Were there going to be COVID safeguards in place, such as hand sanitizer and so on and so forth? You know, factoring in, for example, were these protocols in place at previous protests and more likely to be in place, therefore, at the protest under review. But those more sort of human rights, social justice protests did largely have those types of safeguards put in place. So it does have an impact legally and also policing wise as well, in terms of how everything played out.
Because those protests were a blended range of issues, inevitably there were no real key organisers, and therefore we didn't have the Form 1s, etc. We didn't have the right process, so they were already unauthorised protests under some of this.
Thank you, panelists. We might now then open up the floor for questions. So if you've got a question you'd like to ask, question or comment, it will start off with Alan.
Just a moment, we'll get a microphone. People won't be able to hear you online otherwise.
Thanks very much. That was great. I just wanted to ask a question about the idea, this sort of the spatial metaphor. So the idea of centering the police or not centering them. It sort of seemed to me that if you think about the start of the pandemic, if you think about approaches to public health, then sort of a medical approach wasn't very good, because there wasn't much in the way of understanding of the disease. There's no vaccination, no treatment, and it wasn't even clear what the case fatality rate was. And so then the question is, well, it sort of seems like the medical profession has not got great solutions, and it seems like, well, okay, well, maybe there can be some sort of response through education or sort of PR and trying to encourage people to social distance, but maybe that takes a little bit of time to sort of kick in. And a virtue of policing at the beginning seems to be that its impact is sort of fairly immediate, whereas the medical profession needed a bit of time to help with the pandemic. And so I guess my question was just on the question of centering. Like, of course, right now, if police were a center of the response, it would be crazy, because there's quite good medical responses. In the early days, it seemed like they needed to be closer to the center and sort of gradually move out and maybe be displaced by, first of all, a sort of PR and education response about social distancing and that kind of thing, and then subsequently just a health response through vaccination and better treatments and that kind of thing. So I just wondered what people thought about it. It seems like at the beginning the police needed to be fairly close to the center, but I wonder what people think about that.
I think it's a really interesting provocation, but I think I would think much more broadly about health responses beyond medical. So, you know, if you think about the language we're using now about the shadow pandemic in terms of impacts on people's mental health, I remember feeling from the get-go, and we have heard from services from the get-go, fear. That fear was present the minute it was clear what the kind of scale of this public health crisis was. Imagine if we'd had a response that was led actually about people's well-being. And I think that would have been all the more relevant before we had any of the medical insights around how actually does the disease progress, what actually are the treatment or vaccination opportunities. So again, just to remember that we made choices about what led our policy responses. And, you know, in some ways those choices, you know, there might have been elements of those choices that were necessary, but in some ways I think those choices really cost us. And again, I think the mental health impacts of the pandemic are still with us and are going to be with us for a very, very long time.
And it goes to the point that I mentioned a few minutes ago, several minutes ago, about reimagining the role of police that's been raised by protesters generally, and it's not a new idea or a novel idea, and thinking beyond police, thinking about how you can actually not rely on the police in an emergency or public health crisis. You know, do we start to roll back the powers that police have? Do we, you know, introduce new agencies, new organizations, new services and so forth that can deal with these kinds of things, and not, you know, because essentially what the police are there for is to prosecute, investigate and to prosecute, not prosecute, but investigate crime. Okay, so we need a much more expansive way of thinking about these types of things that doesn't rely on a crime agency, basically.
I'm just wondering if you'd mind if I bring in our online audience a little bit too, because we've got quite a few questions online. So I just thought I might, I know we haven't got much time left, so we probably won't get through everything, and apologies to that. But the very first person to come in is David from Pendle Hill, who says cases in Waverley Council and many of the Western Sydney Council areas were similar early during the Delta variant outbreak. And David asks, what role did socioeconomic factors and the political persuasion, oops, I've just suddenly lost that, but the political persuasion of the local member, so do the panelists think that any of those issues resulted in a difference in restrictions applied in those disparate areas?
No role whatsoever. And I say that absolutely no role whatsoever. There were obvious comments around the level of enforcement in the 12 LGAs in Southwest Sydney compared to the eastern suburbs as well. But I think it's there was no political, you will police this area in a different way to somewhere else. I can absolutely swear on my children that was the case.
Switch between floor and online?
Yep.
Okay.
Having worked just over here for an Aboriginal community controlled organisation for the entire pandemic that went from a support service to a food delivery service, delivering up to 500 hampers per week, I'd be interested to see where they sit on that list, or whether they do, hence the over-policing that they were used to in that community. And then my role being funded to run a DV program, write a program, run a DV program, unable to run it because we couldn't access a hall to run it out of because we had too many people. And then that funding ran out, so it was futile. How long do you think it will take, and how just the acceptance of the punitive situation and everyone's like punishing everyone, do you think Australia is mature enough, and how long will it take for Australia to become mature enough to understand the futility of legislating desperate behaviour?
I wish I had a more positive answer. I feel Australia's, and of course we've got our federal election coming up, and maybe the less said about that, the better, but I feel we are really immature and getting less so. I think our concepts about civil liberties, about the balance, about separation of powers, about the respective roles of parliaments, the courts and police, I think we really as a society have gone backwards over the years in that regard. And clearly there's a lot of people in the pandemic talking about their civil liberties being infringed. And sometimes that is really genuine concern. Sometimes it's these obviously fringe elements who can't or won't accept that there needs to be some kind of limits on civil liberties proportionate to the aim that's sought to be achieved. But it sort of troubles me. In some ways, it's great to see that the majority of the population, I suppose, accepted that there were needs for public health measures, and that when it was communicated appropriately as to why these measures were necessary to stop the spread of COVID, most people were happy to comply. But it also did trouble me somewhat that perhaps there is perhaps a culture of being excessively compliant, or more to the point, being excessively judgy and willing to dob people in, and willing to support a heavy-handed policing response, not just with the pandemic, but the level of support in our community for heavy-handed policing responses, or for simplistic do the crime, do the time type stuff, does trouble me. And the level of and the political messages that get sent out about policing really trouble me, because we have situations in New South Wales where the police minister has more power than the Attorney General, for example, and is seen as senior, and certainly has a lot more political sway, where increased powers are given to police all the time, often undermining the role of the courts. So yes, it really troubles me, and I think that we are not a mature society when it comes to understanding the need for balance and understanding the importance of civil liberties.
We might have time. We're actually running out of time very rapidly, unfortunately. So we might have to have some discussions afterwards here in the actual physical space. But I've got there's quite a few questions online as well. I'd just like to bring those people in as well. So we've got Zoe, I think possibly from Wellington, saying comparatively, which strategies of policing the pandemic were the most effective, specifically comparison with New Zealand? I don't know if anyone can comment on that. Were more communal strategies more effective than strict policing with fines, or is there not enough data to make a decision about that? And I think looks like Greg can answer.
I can say a little bit. I started talking about that earlier when I was talking about the comparisons that have been made between France and the Netherlands. Steve Riker, who was in the UK SAGE group advising the government, has written with Clifford Stott a few papers on this. And one of the things that what they've talked about is how what they call facilitated policing or procedurally fair policing is the best form of policing in order to foster compliance. And it goes to sort of trust and so on and so forth as well, which is interesting because it echoes some of the post 9/11 research that was done here in Australia around counter-terrorism policing, saying exactly the same thing, that community-led responses to counter-terrorism policing, seen as procedurally fair within the community, are the best ways in order to foster trust and so forth in the police. Interestingly, I read a paper based on Hong Kong data, a Hong Kong empirical study, where there was extremely low trust in the government due to the national security laws that were being introduced, but high levels of compliance. Why? Because China, as well as Hong Kong, had experienced MERS, SARS, avian flu, swine flu. So there was an embedded acceptance of cultural acceptance of wearing masks, for example. And I guess there's not in those societies as well, there's not the sort of potential for the sovereign citizen to emerge as well, who is talking about rights violations, entering Bunnings without a mask, for example. So yeah, so that's all I'll say on that point. I don't have comparisons with New Zealand, sorry.
Please join me in thanking our fantastic expert panel and all these great diverse perspectives. So thank you very much to Mick, Jane, Louise, Greg and Tessa. We really look forward to seeing you hopefully again, at least in hybrid mode, if not completely in-person mode at some of our other events. And we have got anyone here who's a higher degree research candidate in criminal justice, criminal law, criminology. We have got a conference coming up in July, a free conference, and you're very welcome to come along to that as well. There's information on our website regarding that. But I would, again, thank you very much to everyone for participating and attending, and thank you and good night.